I'm Alejandro Gonzalez Della Valle, and I'm an orthopedic surgeon in the hip and knee service at Hospital for Special Surgery. Generally, I see patients that are badly affected by hip arthritis or knee arthritis, which is the progressive wear and tear of the cushioning of the hip and the knee. I think that the most important goal is first to understand the patient's problems. We will focus on orthopedic problems, but there can be other medical problems that may need to be addressed first before considering an orthopedic treatment of any kind. And another important goal is to understand what the patient wants, what the patient needs. The expectations of the patient are very important. The majority of our active patients, they want a fast recovery from an orthopedic procedure. They want to go back to being very active, and that dialogue needs to take place for us to be on the same page and synchronized in terms of what we can deliver to the patient. Well, technology has changed orthopedic surgery in the last 10 years, particularly computer navigation and robotics. Essentially, what technology allows us to do is to be extremely precise during the operation. That allows us to deliver very high quality reconstructions through relatively smaller incisions and with less soft tissue damage. That generally leads to a faster recovery, less postoperative swelling, bleeding, pain, and generally increased patient satisfaction. Practice makes perfect, meaning that it's in the patient's best interest to receive care by a high volume surgeon who works in a hospital that is devoted to orthopedic care. I'm very fortunate to work with a group of nurses and surgical technicians that accompany me in the operating room every day. I have no doubt that the work of our surgical team has improved the outcomes of our patients.